Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is Autism and Stomach-Intestine-Colon Flora. This segment is part of my seed, feed, and occasionally weed protocol for restoring the flora of the stomach, small intestine, colon, and of course also the oral cavity. My experience has taught me, more specifically, my patients who were given the diagnosis of autism and their parents have taught me that the results are far, far better when you're trying to restore their vocabulary, their social connectiveness, and sometimes the results are truly dramatic. Sometimes the results are very delayed. But I believe that no program for autism should be considered complete without looking at the essential connectedness of the stomach flora, which in many children includes Candida, H. pylori, yeast species, Streptococcus, the flora of the intestine, especially the lower part of intestine, and of course the flora of the colon. The model of seed, feed, and occasionally weed, I conceived this model and introduced almost 25 years ago because I recognized I had written a monograph at that time, Altered States of Bowel Ecology. I also at that time introduced the concept of ecologic thinking when we think in terms of health, absence of health, and disease continuum. If you have seen some of my other segments, you know I often say, as roots are to roses, so the bowel to the brain. As roots are to roses, so the bowel to the brain. Without healthy root system in healthy soil, you cannot expect celebration of colors in your rose garden. Of course, you also need sunshine. And children with autism also need sunshine. So this seed, feed, and weed approach means seed the entire alimentary tract with probiotics, yogurt, kefir. Feed them with the nutrients that good probiotics need, Acidophilus, Bifidobacterium, and those would be vitamin B6, vitamin B12, minerals. And of course you have to be equally aware that you want to weed the bad guys, and for that you have to really think of sugar and antibiotic abuse. You have to think of mold allergy, food allergy, gut fermentation, leaky gut state. Because every time I have studied with urine sample the Krebs cycle metabolism and the mold toxin excretion in the urine of children or adults with the so-called Asperger syndrome or the autism spectrum, every single time I found evidence of excessive mold toxin production, tartic acid, furon, and also clear evidence that their Krebs cycle ATP generation is impaired. There are a large number of segments where I dwell into this crucial subject, but here my central message is very simple. Anybody who is involved with the care of children, adolescents, adults with the so-called autism spectrum should really think integratively, think holistically, and not forget or ignore the issues of the gastric flora, digestion. We need digestive enzymes. Sometimes and the oil rubs that I talk about, castor oil, sesame oil rubs, there is a whole playlist channel on castor oil and sesame oil treatments. Children's Health Foundation is a nonprofit foundation founded by my wife Talat and I, with our mission of spreading authentic information untainted by corporate deception as well as by ideological transgressions. And we focus on issues of nutrition, environment, and stress for children worldwide. You can support us, forward this YouTube segment to your email, Facebook, Twitter, LinkedIn contacts. You can also send us an email, aliacademy7@gmail.com. 7 is the number. And tell us how you would like to participate in our effort, how you would like to contribute to enhancing the value of this encyclopedia of children's health core. Our website is www.kids123.org. Thank you for joining me. Until we meet again, may you be gracious, graceful, and generous in your spirit. Thank you.